Hello and welcome back to the Pulse of Spokane. I'm your host, Ryan Meza, and I'm joined here with a very special guest. She is the CEO and co-founder of WorkWell Consultants. I'm joined with Kathy Worden. Thank you so much for joining me. Yes, of course. So just for our viewers that might not know what WorkWell Consultants do, what is WorkWell Consultants?
So WorkWell Consultants is an employee health management company, and so we work with a variety of different, we call them clients or partners, from small employers to large employers to insurance brokers to insurance plans to help provide biometric health screenings and consultation for employers' wellness programs, their healthcare initiatives, and tying it all together. But most importantly, how do we work with employees in order to identify what their potential health conditions are and connect them and empower them to take the next step that's appropriate to help them self-guided in their wellness program.
Yeah, most definitely, and all those benefits that people gain from working in a job, of course. Especially right now, health is a big issue of ours, just with COVID and everything. Has COVID ever just like changed things that you guys are doing now in your consulting?
Yeah, so we had to take every day do we go forward? Do we go right? Do we go left? So every day is kind of a new day we look at because of COVID. And so because of our established relationships with our lab partners, we were able to utilize them to provide COVID testing to their employees. And so we've been able to shift our focus to meet the needs of employers in the community as well. And so,
Yeah, most definitely. And now that we're seeing people just due to COVID working from home now, does that change your consulting a little bit and just how you kind of balance the two?
Yeah, so we took a shift to doing COVID, and now we're seeing employers really trying to figure out how do they integrate the pandemic into wellness, because a lot of employers, they still have their wellness programs in place that are tied to premium incentives and to the engagement with their employees. So they're having to shift from everything on site and their virtual platforms to how do we meet the needs of employees who are not coming back to the workplace or transitioning. How do we meet their needs in a different way, whether it be more remote coaching, taking the focus almost to the family more than the employer group, because where are they spending their time? A lot of employees are spending their time at home now. So we're in the process really right now of trying to understand what the needs are for the employers and the brokers and the insurance companies, and trying to create solutions that best meet those needs moving forward with wellness and with COVID.
Exactly. And I just personally, with me, when I think of wellness, one thing that I really think about is just like self-care and just like taking care of yourself above all things. Do you guys focus on that as well, or is it more just like the physical health of employees?
It is both. And so again, our main service line has always been biometric health screenings and testing and on-site, and really that engagement. So our business model has really been focused on how do we understand the needs of the employees, of the employers, and how do we understand their barriers, and how do we create solutions that decrease those barriers to improve health. And so we are looking at more of a holistic manner because we are seeing that those stress, the isolation, there's a lot of different factors that are coming in that are affecting their physical health. And really we see our role is how do we help the employee navigate that and get them to the next step in order to address their health, which is a little bit broader than we have been used to.
Most definitely. 100%. And so you're mentioning that your clients are mostly brokers, insurance companies. What other clients do you guys usually take in from WorkWell Consultants?
So really, and again, employers. So we have screened probably every small business in the state of Washington over the past out of the past 5 years. But really, large employers, small employers. So we kind of find in the Pacific Northwest, we can really meet the needs of a variety of different clientele with different demographics, because we are nimble and a little bit smaller than the big box screening companies. And we really see our role as a connector. And we are one of the most important connectors, because when we go on site or virtually, or we have that interaction with that employee, really we make or break the wellness program, we feel, because we've got 10 minutes to understand somebody, to do their testing, and then to give them the results and empower them to make the next step.
Yeah,
So
definitely.
really we see us as a really critical part.
Mm-hmm.
So we need to really understand the landscape which we're walking into and meet the employers and the employees where they're at, instead of them having to fit into our box.
You guys. Yeah, most
Mhm.
definitely. And
Yeah.
you just mentioned before we went on air, just you're more focused on finding solutions for employees and employers. And I know you said like 10 minutes to like find out like their history and like their health and all that. Is it hard? Is it difficult to kind of go into that vulnerable setting with somebody to understand like their history and their life and about their health as well?
No, and I say that because the cornerstone of our company is the people we hire. I can teach anybody to poke a finger to read results, but what I can't teach somebody to do is how do you immediately connect and engage. So we have prided ourselves, and we've really grown our company based on the people that we hire. And so we hire people that can engage in that quick amount of time, that they have empathy, but they also can kind of draw the line in terms of, really having them leave with the urgency of potentially a health condition that they haven't encountered, or that they do. And I think that we also we are able to adapt to different demographics. Your blue-collared worker to your white-collared workers to your lawyers to across the board.
Exactly.
We really pride ourselves in being able to connect with those people and really get them to the next step. We do see that 20 to 30% of any given population doesn't even have a primary care provider.
Really?
So
Wow.
one of the things that we really see is how do we help connect them to a primary care provider, one that really meets their needs and that they can engage with. Because if we don't do that, then we have felt like we just keep coming in and doing the same thing over and over again and not taking that next step. And we find that employees really want their hands held in the realm of health. It's the one area that they don't want to be pushed off.
Yeah,
so
it's scary.
To get them to open up to us happens real quick.
Okay, good.
Because of the people that we hire. If we didn't hire the people that we did, I think that we would not see the results and the engagement that we see with employers.
Most definitely.
Yeah.
Creating that friendship and that relationship right off the bat.
Yeah, and
Very
it can
important.
happen very, very quickly. And we have a variety of different people that we hire, and they all have their uniqueness about them. So we're able as well to kind of fit the population with who we send to screen based on their strengths.
Okay.
Yeah.
Wow. Awesome. That's so fascinating, and it's amazing to learn. I know. I just feel like that's so important to just have that, feel comfortable and like be in that safe space that you can just like let yourself vent or like let someone else come into your life and help you out. It's really important.
Yeah.
Awesome.
Our problem is we don't have enough time sometimes.
Yes, I know, right? 10 minutes.
That people do. Yeah.
I know. I'm sure virtually too.
Yeah.
It's a lot different compared to like being in person and having that face-to-face interaction.
Yeah. And we are exploring that more again as the dynamic and the landscape changes. How do we be nimble enough to address that? And we have seen that we have such a great community that we can test a lot of things out. We have employers who really like the idea that we understand your need. Here's your barriers. Let's try something different.
Yeah,
and so
see
that's
what
been a
works.
great opportunity for us to really think outside the box and be nimble enough to meet our clients where they're at.
Yeah, most definitely. You really love what you do.
I
don't
love
you?
what I do.
I'm
I'm passionate about it.
I can tell, and that's going to go far.
Yeah.
I love it. Awesome. Is there anything else you'd like to add, or maybe more clients or friends that you like to join WorkWell Consultants?
Well, I think that our, we're always striving to see how we can integrate with the community, with different organizations or different ways that we find those connections. So I think that we're always looking for new opportunities, but we're also looking to see how do we be a component that really shifts healthcare and how healthcare is delivered.
Yeah.
Again, because we think we are in a very unique situation
Yes,
that
definitely.
I've got 10 minutes of your time and I can really make a difference and hand you off to the best place for your next step.
Yeah.
So we really try to understand what the employers are looking for, what their barriers are, and we have found that a lot of people in our space don't do that.
Okay.
And so people love to tell us what they
think,
want, and then we're able to share that with brokers, with community members, where one of the things that before COVID happened, we were really working hard with the healthcare system in town to connect people that didn't have primary care providers to a primary care provider.
Yeah.
And so, we'll get back on working with that once kind of things settle down.
Hopefully, yeah.
But that's where we love to find connections and figure out.
Yeah.
We are a screening company, but we also are very public health minded.
Yeah,
and so
and building that community as well.
Building that community. So we sit, and again, I think that is a differentiator between us and large big box screening companies, is that we see ourselves not just as somebody coming in and turning and churning and doing screenings and testing, but rather, really looking at it as the community.
Yeah, and get deep down into that core of the problem.
Yeah.
Awesome.
We are expanding. So one of the things that we have been doing, that again, right before COVID, is doing some more direct to consumer, because we also saw the need that people that have diabetes, they need their A1C tested on a regular basis. So rather than them going to a lab, to go to their doctor, to go to a lab, they can just do an A1C test at home, self-administered, and have it go directly to the lab. So we're expanding into direct-to-consumer with additional tests besides just lab tests, but genetic testing. We've kind of gotten into that niche of genetic testing for performance, weight loss, aging, and nutrients that really kind of provide a blueprint, as well as food allergies, environmental toxins. So really kind of expanding our testing menu that we are seeing, and we're finding that with COVID, that's proving to be very beneficial, because employers and the public are looking for other avenues to, how do I really engage with my health?
Yeah, without risking it, with going outside and going to a hospital or a doctor.
Being in the new
Exactly.
landscape.
Wow, that's very beneficial for your clients as well.
Yeah,
wow,
is.
So up in 12 years running, keeping going.
Yep.
I love it.
We are, and we're looking to expand more on a nationwide level, just because we're seeing that employers have different satellites, and how do we meet those needs?
Yeah,
so,
and the results are there.
The results are there. So
Awesome.
it's at first we were like, oh no, COVID, but how do you embrace it, and how do you take that opportunity to really help people
help others,
with their health? And right now, I think we're seeing that COVID is showing that your basic health is incredibly important to being able to combat viruses, and that's really making a difference. So we are seeing employers saying we can't let wellness go by the wayside, which when COVID first started, that was kind of what we were seeing happen.
So teeter-totter, going back and forth.
Right, so now we're seeing employers saying we really have to embrace wellness in a different way, but we really have to embrace it now, moving forward with the uncertainty of COVID and vaccines and getting their people back to work.
And the employees as well.
Yeah.
Wow.
Yeah.
Thank you so much, Kathy. Amazing stuff.
Thank you.
Yeah,
I could talk forever about it, right?
No, I love it. I was just, it's so fascinating. You guys are doing great things here in Spokane.
Yeah.
I'm hoping you guys can really expand out nationally and do what you guys are doing for the public.
Yeah,
thank you so much.
That's our plan.
Thank you so much, Kathy. That's all the time we have today here on the Pulse of Spokane. I'm your host, Ryan Meza. Have a great day.
At Wendell Nissan, you are respected, you are valued, and we have an experience tailored for your lifestyle. WendellNissan.com allows you to research and find the perfect vehicle and financing information prior to arriving on our lot. Whether it's the 2020 Rogue Sport, Rogue, or another Nissan model, our trained staff will help you find the perfect fit. For your tailored experience, come see us at Wendell at the Y or WendellNissan.com.
When we opened the doors the first day, we started with a counter full of maybe a dozen selections of a dozen cupcakes. We sold out, and it just went crazy from there. I'm Sally. I run Sweet Frosting's Blissful Bake Shop downtown Spokane. It's almost 40 years of baking for me. We now do between 1,000 and 2,000 cupcakes a day. The variety of cupcakes is kind of like the variety of services that STCU provides for us. Since we opened this site in 2014, they've been our banker. We are producing for 4 stores right here, so we have 35 to 40 employees at any one time. There's an STCU close to virtually every one of my stores, and every time I get a new employee, that's the first place we send them. STCU is such a good fit. It's just so convenient for me to have them as neighbors. They are always so pleasant and always so helpful, and we have a lot of little needs. They've always been behind me 100%, so it's a good thing to have that partnership.
Here at River Ridge Hardware, we carry a great selection of Krylon brand spray paints, Color Master, a general purpose, the Rust Protector for taking care of metal, Fusion for taking care of plastics, and the Super Max that can take care of it all.
Weather in the inland Northwest can wear you down. And if your gutters are in poor condition or you do not have gutters, you could suffer damage that could cost a fortune to fix. Rainman Seamless Rain Gutters has almost 30 years of professional experience in serving the inland Northwest region and strives to ensure customer service that is second to none, from the time you call to the end of the project.
Thanks for watching. Ask the host a question, recommend a guest, or check out any of our other programs on Facebook, YouTube, Twitter, Apple Podcasts, Spotify, or SpokaneTalksMedia.com. Sponsored by Local 29 Firefighters Union, Well Dressed Walrus, and Homes for You.